So I always start on a high note because, this show is really about trying to be on a high note. We've gotten to a very hot summer since last time we talked in July, and there's a lot of things in the conventional media that increase people's temperatures, anxiety, depression. And the whole thought behind this show is it doesn't give you hypertension, right? You don't listen to the show to get upset or angry or yell. It's almost like therapy.
Mm-hmm.
You don't have people talking over each other. You don't have people yelling at you. It's all about how can we inspire people who listen to live their best life possible and to be loving and kind and respectful. And that's a challenge. And somebody asked me one time, well, do people pay you to do your show? I said, no, I pay for the show. This is my gift, because I always believe, and I tell every guest in my show, that if we can touch one person out there who's hurting, who can we give him some advice, some inspiration, we can lift them up in one way, we would have accomplished what we intended to do with this show. If you can touch at least one soul out there. So I'm going to reach out right now. I'm going to honor a bunch of people I know personally, and I want to wish them happy birthday, because I think life is a gift, and every birthday is a gift. And a lot of people bemoan, oh, I'm getting older, I'm tired. Hey, be grateful. You've got a birthday. A lot of people don't make it that far, but these people have made it this far. This is their birthday month. Marlene Slale, happy birthday this month, dear Marlene. I think I'm going to see her in a couple of weeks. Herb Marchman in Colorado Springs is having a birthday. Rachel Leonard, who used to work in my practice, celebrated a birthday this week, as well as Scott Gordon, who I just saw yesterday in my office, had a big birthday. And I told him, he's always like very ticket-minded in getting projects. I told him that he has to have a little ticket that says, have fun today, because it's hard for people to unwind and just enjoy your birthday. Denise Pettis, who's been my friend for many years with my late husband, John. She and her husband, Jay, live in Virginia. Happy birthday. Doug Bender, who's in Coronado Island. Jolyon Grant, who's an old attorney friend of ours. Lieutenant Colonel Mary Tess Hinko. Mary Tess is the daughter of my first cousin, Jose. 40 plus years ago, when I was an intern, I was in the delivery room when Mary Tess was born. Her father was my first cousin. He was U.S. Navy. And I was an intern, just graduated from med school, and they were having their first baby, Mary Tess. We didn't know what it was back then. And I was rotating through GYM, and the resident goes, well, your cousin and his wife are here. Do you want to deliver the baby? I said, a little too close. I'll just be on your end watching you deliver. So I never forget her birthday. And it's almost like a reminder to her. She is a lieutenant colonel in the Air Force. I did commission her after she graduated from her nursing degree at University of South Florida. She is stationed in Ohio. And when she graduates when she retires from the Air Force, hopefully as a colonel, I'm going to try to recruit her to come join me, because we need good nurses. Brilliant. And she's a great administrator. Bernie Orjonia, my cousin Remy's husband, happy birthday. My sister Lori, my baby sister Lori in San Diego, has her birthday this month. Thomas Gorney over in Texas. Virgie Lindsay, happy birthday. Dr. Carla Lem in Boston. Master Chief Joe Fama. Master Chief Fama was one of the 5 Filipino-American active duty enlisted valets at the White House who helped take care of the president. So I spoke to Joe a couple of weeks ago, and I'm planning to go visit him probably later this year to say hi. So God bless him. Dr. Roseanne Coe, head of GYN at Banner, a dear friend of mine. Happy birthday. Bob Bandegna, Pam Case, Larry Venturelli, Chuck Moning, who is a builder friend of mine up in Sedona, Judy Needle, and former president and former patient, President Bill Clinton, is celebrating a birthday. So happy birthday, Mr. President. Or I can't sing like Marilyn Monroe, but I like to joke. So yesterday, I talked about the timeliness of my show. I had planned this show and the theme and the guest about a month or so ago. So yesterday, truly, I was in clinic and I get this call from a patient of mine who is spending the summer in Colorado with her husband. They're renting a house. And she said, I could just kill my husband. And I said, why? She says, we were on a golf cart and I was sitting in the passenger side of the golf cart and he did a quick 360 sharp turn. And she goes flying off the golf cart, lands hard on the pavement. And then she goes, I can't stand up. I literally cannot weight bear on my left hip. I said, did you hit your neck, your head? No, I can't. So I said, you know what? Have your husband lift you up or call an ambulance, go to the emergency room. So they did. And she wound up having a left anterior tibial plateau fracture.
Oh, no.
So now they're working on orthopedic guys. And I said, well, you landed in the place that you have plenty of orthopedic guys in Vail because, sports injuries, right? Not a great place necessarily for a heart attack, but if you've got an ortho injury, they're everywhere. So she's getting seen tomorrow. They're going to do some surgery. But I was just thinking about that. I was just thinking about when you think you're healthy and everything's great and you've done everything right, you fall down, something happens. And who you're going to need, right? You're going to need a good orthopedic person. You need somebody to diagnose. But the key after the surgery is the recovery. Because, surgery can only take you so far, but to get you back walking again and doing the everyday things that make us autonomous and functional, you need to recover. And what does that look like? And you need trained professional people, such as physical therapists. And I thought, what a perfect thing to not only honor physical therapists, but to talk about somebody who is a professional doctor of physical therapy, who's also a friend, but who is a doctor of physical therapy, who's hands-on, who really does a lot of their work touching lives in that way, working with the body, but also the mind, the spirit, to encourage them, to motivate them. And so we have over 313,000 licensed physical therapists in our country. But we are fortunate today to have one of Arizona's top physical therapists, Doctor of Physical Therapy, Amber Enright. Welcome.
Thank you. Thank you so much. I'm so excited to be on the show. Thank you, Connie.
So let me give them a blurb about you.
Okay.
You are a healthcare trailblazer. You're definitely inspiring positive change for individuals in your community, among professionals, and also in the Phoenix, Scottsdale area. Mm-hmm. Your mission, you told me, is to improve healthcare accessibility. You've traveled extensively. You've served underserved communities and individuals who are neurodivergent. Mm-hmm. So we're going to talk about that. You started your first business treating those with brain cancer, dementia, chronic illness. And so it's interesting because, when you look at Amber and we're doing the visual, I mean, she's stunning. She could be a model. And I'm trying to get her a gig on television, and people would think, well, why aren't you doing sports medicine? Because they'll think you're an athlete. You are an athlete.
Yeah.
But, why aren't you sport? But you're looking at, and it's depressing. I'm an internist. I take care of people with dementia, cancer. You're talking end of life. Mm-hmm. And some people would think, well, just shoot me. I'm done. I said, but we're going to talk about your patients, people in their hundreds who are getting physical therapy because it's not time to go yet.
No.
And so beyond your practice, in addition to your full-time job, which is heavy, you co-founded Scottsdale Living Business, Women's Editions in 2020, and you foster community. And you are the queen. You're the queen of networking. 2021, you started Scottsdale Top Docs, which is they challenge the current barriers to quality healthcare. You bridge the gaps between different providers. I mean, you get people meeting each other and talking to each other. Because a lot of times you never get to meet other providers. It's just a consult and nope. You don't get to meet them on a social level.
Yes.
And it's, or you're, quote, competing. And we're not competing. No. I tell people, we have patients everywhere. There's somebody for everybody. And perhaps patient's great for you for a while. And then they'll come to me and they'll give them, we're all in this together. And so I want to start in the basics because, I want actually to inspire people to go into physical therapy, listening
Love
to you.
It. We can do that.
So how did you, tell us what a physical therapist is and how did you decide to become a physical therapist?
Yeah. So I have the best job in America. Physical therapy is not just what people used to think it was. Like, oh, my knee hurts. Oh, my back hurts. I broke my shoulder. It's a lot more now. And over the last 20 years, it's become essential in the hospital setting, ICUs, after transplant care. Essentially, if you have any mobility issue or chronic illness, you may need some kind of recovery plan. And although we're not MDs, meaning we have nothing to do with pharmaceuticals, we are not giving you a pill of any kind to take and we also don't diagnose. We leave that to the physicians. But what I look at is a lot of times people have no idea what a functional limitation is. It could be something really simple like, well, I'm scuffing my foot a lot. I keep tripping on this carpet in my house and my wife keeps telling me that I'm not picking up my feet, That could be a functional impairment that leads to a fall. Or, well, I walk the golf course, but I cannot get up this stair in my house because it's not a standard stair. There's a lot of things that can be considered an impairment. So how did I get into physical therapy? My family used to do foster care. We had foster kids all the time. And we had really some kids that had really massive impairments. We had one baby who was 10 months old, and she had essentially lived in a carrier for 10 months. So this 10-month-old who should be exploring standing and taking their first steps was not able to pick up her own head in any direction. At the time, my mom kept saying, and my mom's like, OG mom that knows everything about parenting. And she has a 25-year gap between her oldest and her youngest child.
Wow.
Okay. So my mom is a mom, and she kept telling us, lay the baby on her tummy, and Heavenly would lay there and just be upset. And we would all get down and like put our faces in her face and distract her with toys for a little bit. And then she'd like look up and start doing this. And 10 months after she had those experiences, she was walking. I had no idea that that actually was something that we could foster just through experience, just through changing her environment and allowing her the opportunity for novelty.
Yeah.
Novelty is something that kids are not afraid of and adults are. So when I went into physical therapy, I always thought, I am so amazing with kids. I'm going to do pediatrics. This is my calling to work with little children. When I went into PT school, I knew that I was going to do that. But when I went out into the field, I worked in my community, which was Sierra Vista, Arizona. It's a small town. It has a military base attached to it. And when I went back, I thought, I'm going to change healthcare here, because it wasn't really much. We had 20 therapists there, but we served everything from Mexico to Tucson and sometimes to Phoenix because people couldn't get an appointment. So my job felt really big, and there were no other therapists. Like, people would bring their kids from Mexico to come to this clinic in Sierra Vista. And the job was big, but the other population that was really underserved was the neuro population. So there was no one to see patients with spinal cord injuries. And so in my day, all of the therapists were doing orthopedics. And to me, I thought this is well served. You said 313,000 therapists, and the majority of those are treating orthopedics, knees, shoulders, hips, and they do the same thing all day long. I also found that, no offense, to be very boring. I didn't want to see 25 shoulders in a day. I wanted more diversity. So I ended up jumping into this population that nobody wanted to treat. And it was a little trial by fire, but I loved it because I love learning. And I think that that's a little bit of my fountain of youth, how I have energy, is because I like learning new things. I love solving the puzzle. Neuro is a puzzle piece, and so is pediatrics. The only difference is the I can't. Kids reach a certain age, they've been told, no, no, no. And so then they become scared to try things. And adults have that built in. So it's my job to excite them into trying something new and to trust me that I can help them get where they want to get. So that kind of is how I got there. I learned about physical therapy and was like, I hate blood. I hate needles. I want to do medicine, but not that. And I just was ready for this. And I knew it immediately. Once I found it, a light bulb went off and I said, nothing is going to stop me from this goal. And it's not that there weren't barriers. I just decided this is going to happen.
How do you get into physical therapy school?
So I went to NAU, which is actually, it was ranked 9th in the country when I applied. And this was right around the housing crisis. So there were 580 applicants my first year, and there were only 48 spots at the Flagstaff campus at NAU. And I actually didn't get in my first time. I felt like a failure. And I was like, this isn't for me.
Do they look at GPA?
Oh, they look at everything, but you're 1 in 10 is going to make it, and you're a piece of paper. And I didn't really get it. And I'd written this essay. It was like, I want to be a PT because like that was it. And it was just trash. And so I sat and essentially stalked the faculty because I worked on campus across the way, and I got a meeting. I got a meeting with someone that was on the interview panel. And I was like, listen, I don't know why I didn't get in. Can you help me? And they're like, what on this paper makes you stand out? And they like pushed it to me. And I was like, whoa, I am accountable for this. And I'm competing. Like, I didn't realize it. The second year I applied, there were almost 1,000 applicants because it was literally right when the housing crash happened and everybody wanted student loan money to go back to school because they essentially weren't making enough to make ends meet. And this was actually a great way to do it.
Wow.
So I knew if I got an interview, it was one of 150, and I would only have to beat out 2 people. My goal was to make my paper so good and point out the things I had never pointed out. And if I hadn't had that meeting, I never would have understood how important it was to look really good on that piece of paper and point out those things.
You didn't give up. You had the courage to say, I want to get in. And then you actually asked, you humbled yourself and said, what do I need to do?
Yes.
Right.
Without asking that question. And I love that word, courage. I've been actually focusing on that word for 2 weeks straight lately, because it takes a lot to face our fears. And all of my patients do that every day. It doesn't matter how much they're struggling. First, you have to ask for help. Then you have to take accountability. And you're not going to get better if you don't do both. You're not. So that's my journey into it.
So how many years of training?
I've been practicing since 2012. And you go to undergrad and you pick anything, honestly. NAU is like the master of pulling people from every background and then saying, I can teach you what you need to know to be great at speaking with people and taking care of people in this way. And you don't have to be a cookie cutter PT to do this job. You just need to know how to think and problem solve. And here is the general gist of this. Great, brilliant advice for any career. And then you go and get your doctorate. When I was an undergrad, they actually had a master's of OT and a doctor of PT. And I thought I was going to go to school in Pennsylvania at this university that offered a dual degree. And then I got too scared to apply. And so this word courage that you use, like I've always struggled with finding enough courage to do something, to find enough. It's truly internal. So you go through essentially undergrad, you go through a graduate school degree. And in that graduate school degree, you also have not just didactic work, but the clinical work. And I was a homebody and I could barely talk to people. That sounds so weird now. I know you probably can't imagine me that way, but like I would run into poles walking through middle school, like dunk.
You could just stand at comedy or sit down comedy.
Yeah, everyone take your seat, please. I'm going to make you laugh. So I'm like walking through the hitting poles. And when I went to college, I started blooming. You know, I'm making friends, I'm independent. And when I decided to do my rotations, I plugged myself into circles in cities where I didn't know anyone. On purpose. And it would take me 4 to 6 weeks to park myself somewhere to get to know strangers. And I think it was the single greatest thing I ever did for myself, was to put myself in an uncomfortable situation and force myself to grow in a way that I never would have without those experiences. Later, I did traveling. That was also a lot of that. So,
but you have in addition to your day job, you've got a full life that you bring into this, and you pick probably the most difficult specialty. I think anything when someone's on the decline, you break a hip, we'll fix it. Fine, we're done. But you're dealing end of life. I mean, we're talking a little bit about just functional ability and how, you have male, female, your patients vary. What's the average age of your patients?
So I see currently, I have patients who are in their 30s and my eldest patient is 101. And so the age range can vary greatly. As far as the neuro and oncologic care goes, typically I'm actually seeing people much younger than people would think. So starting in their 50s and going up to about their 80s. So, I mean, everybody thinks that they know what dementia is, and they think that it's an older person's diagnosis. There are many forms of dementia. The second most common form of dementia is called Lewy body dementia. It very strongly mimics Parkinson's disease. And it's kind of like if Parkinson's and dementia had a baby, it would be Lewy body.
Exactly.
So
when we look at it.
And it's interesting because all of these diagnoses, like brain cancer, we hear a word and people get some information. You get a little support group information. You get a little like, I'm going to see you again in a year. We got to do this MRI. You might need a surgery. You need this medication. But how do you live day to day after you hear those words? What am I supposed to do? And in America, unfortunately, we have a vision of health and illness. And illness, when we have heard we're ill, we think hospital bed. We think people coming in and saying goodbye. And it literally is not that if you don't choose it. You can, and here's the wild part. Our hospital system is highly medicine, physician focused. It essentially discharges you into the world. And yeah, there's acute rehab, there's skilled nursing facilities, but it doesn't ask you what your goal is. It doesn't even ask you generally in that system, where were you before you got sick? And how long ago was that? Where's my target here? I need to know that. So like I have patients who are geniuses. They are literally geniuses. I have a person that does math and numbers and music all at the same time in his head. I mean, geniuses. They have run multinational companies. They have been consultants of every different kind. And I'm telling you, every day I learn way more than whatever they think I'm giving them by being with them. But they are absorbing something when I walk in the door. It's energy. It is goal-focused assignment. It is accountability for what their job is to live a full life right now. Like everybody's like, well, we're all going to die one day. Yeah, but these people actually had a second chance at life when they heard those words. And some of them actually, this is kind of fascinating. A lot of my patients have been to a support group for whatever they're going through. And support groups are so fantastic. But at some point, support groups can also sometimes cloud how we're able to get out of the notion that we're in something long term. And so what we want to do is ask, what is your goal? What is the most important thing I could help you do? And how long can we do that? How can I make it safe? How can I help you preserve your dignity? What does that mean to you? Like, really, what does that mean to you? Some people, they're like, I need to be able to hold my grandbaby next year or walk my son down the aisle. Sometimes it's smaller than that. I want to go fly fishing.
Yeah.
I mean,
what makes your functional life? We're going to pause for a quick break because I want to delve more into what you do. I mean, what you're showing, definitely you've got the skills that make, rehab important. But the key thing is you tap into the human being. You tap into the motive. I mean, you are sort of the sales rep. You're the coach. You've got to know them so well, because what's going to motivate them to have them believe, not afraid, but to know I can do this. I can do this, and I'm going to do it without hurting myself.
Yes.
And the goals, because nobody asks them, well, what's your goal? What do you want to do? We're just going to check the box and you get so many sessions and we're done. I mean, what does rehab healing look like to you? And that's what you ask. So we're going to take a quick break and we'll be back with Dr. Amber Enright on House Calls about hands-on healing. So stay tuned for more.
Follow Voice America at facebook.com/Voice America for juicy updates from your favorite radio shows and podcasts.
Who's your doctor?
When I was looking for a doctor, I thought, which person gets the best care of all and whose doctor's credentials are the most carefully reviewed? Well, the answer was obvious. Who looks after the President of the United States? My doctor is the doctor who has taken care of 3 presidents and their families, Dr. Connie Mariano.
I've heard about her. She's board certified in internal medicine and has been practicing medicine for over 30 years. She was at the White House for over 9 years and traveled everywhere with the president.
Dr. Connie is available to me 24 hours a day, 7 days a week by email, cell phone, or Skype. And when I see her in her private office in Scottsdale, she and her staff always treat me like I'm the president.
I'm going to call her office now and join her practice.
Dr. Connie Mariano is the doctor American presidents and their families have trusted with their lives, and I trust her with mine. For information about Dr. Connie Mariano's private practice, you need to visit drcmariano.com.
Are you ready to live younger, longer? Andrew and Erin Stevens with Apply Everyday Health are partnered with a 100-year-old company to help you build health through natural approaches. Our scientists believe that the key to a healthy lifestyle lies within nature. By using ingredients proven to be safe and effective, our products provide nutrition guaranteed to change your life in a positive way. To find out how you can get the same top-of-the-line vitamins taken daily by Olympic athletes, astronauts, and the White House doctor herself, visit applyeveryday.com.
Friend us on Facebook to keep up with what's empowering the world. Voice America Empowerment.
You are tuned in to House Calls with former White House physician Dr. Connie Mariano. If you have a question or comment for our show today, please call in to 1-888-346-9141. That's 1-888-346-9141. You may also send an email to drconnieradio@gmail.com. That's drconnieradio@gmail.com. Now, back to House Calls with Dr. Connie.
You know, listening to the break and the commercial as it leads on, the announcer mentioned former White House doctor, which I was for 9 years. That was 23 years ago. And I do remember probably the most difficult, challenging time I had back 23 years ago with former President Bill Clinton, whose birthday is this month. Happy birthday, Mr. President. Is he tore his quadriceps tendon. We had flown into Florida, and he was meeting with Greg Norman, staying at Greg Norman's house. And that night, he was going over to the guest house, and he was stepping down some steps, and his leg snapped, and he tore his quadriceps tendon. Mm-hmm. And so the next time I saw him, I was told by the nurse, there was another doctor there, my ER doc, I think it was Rob Darling was with him. And we met at the emergency room in Naples Hospital. And I got there ahead of time with Secret Service. He was in the ambulance. The press slept in. They didn't know he was there. And so we opened the back of the ambulance, and he's in this gurney. And he looks at me, he goes, "I'm sorry, I said, you know, if you'd just gone to bed and just called it a night, this wouldn't have happened." I was like nagging him. I was nagging him. So then we did the MRI. It was a long night. He tore it. He severed it. And we decided we would fly back on Air Force One. They were under crew rest, back for Air Force One, and orthopedics would operate on him, which we did. I was in the OR. And then he was in the presidential suite for like a day or two. And he goes back to the White House, right? So we have physical therapists. That was my time with physical therapists. And I still remember them. They were amazing. Physical therapists who work with us, the chief of physical therapy, and then his assistant who was adorable. It was a great team. So, but we remembered going into the White House and realizing it was not handicap friendly back 23 years ago. The shower didn't have any rails. The bathroom, we had to handicap proof the second floor of the residence because you got a guy in crutches.
Yep.
He's got crutches. He can't bend. And then the medics showered him. I'm like, I'm not, they were there. They were bathing him, showering him. The first lady was on a foreign trip. She quickly turned everything over to me. She goes, "I got to go to Europe." I said, "Ma'am, you sure you don't want?" No, you got him. You was like, "Thank you very much." Mm-hmm. So I slept down the hall in the Queen's bedroom. It was really cool. So we had the team there. We took care of him. And then he went to Helsinki to see Boris Yeltsin. And we're like, what? So we brought with us the physical therapists. Yeah. They came with us on Air Force One. But that made us appreciate, we got to go into the home to see, for the President of the United States, he needed physical therapy, and he recovered. He recovered, he did it fine. But, you talk about and you've taken, I know you can't mention the name, you've taken care of celebrities, you've taken all, but I'm always fascinated by the ages. You have somebody over 100?
Yes, 101.
Why do you, what does she see you?
Honestly, it's to keep her moving because she's very cognitively adept and her body was just hurting. It's interesting because we all can have that. Like you cross your legs at the movie theater with your feet up and you put your knees down, and after 2 hours, or say it's a really long, you're watching Avatar for 3 hours. Now your butt hurts, your hips hurt, your knees are locked out, and you put them down and you're like, climbing out of your chair. And so, imagine that times 50.
Oh, yeah.
Age is not a disease, but at some point, everything's breaking down. I say, like, everybody over 40 has degeneration in their joints, especially if you're a weight-bearing individual. Like, it's going to happen. And they're as common as wrinkles on our skin. Some of us have less wrinkles and some of us have more wrinkles at a certain age, but the aging process does happen. The age itself is not the disease. So keeping her moving meant addressing things like joint restrictions. So how far can her ankles move? Does that push her knees forward and her hips back? So how people get like kind of in that crouch position at a grocery cart? Mm-hmm. All right. So that often is like their joints are too tight in a certain direction, often front of the hips, behind the knees, and behind the ankle. So you're kind of thinking that they're stuck in a recliner position, even though they're standing up. And that should make sense to people. And then they go to sleep and they lay on either their back or their side. Almost everybody kind of does that as we age. We don't get onto our stomachs. We don't take steps backwards. And so our body tightens down over time into certain positions. So the best thing that we can do, and the people that I know that are the most mobile with the least assistance, like I have a 95-year-old that walks without a walker in her own home. Period.
It's amazing.
She stretches every single day. And I actually work with her on frozen shoulder. because she needs to be able to get her plates out so she can make something and heat it up. And she is so pleased to be able to move. It's one of the best parts of her week, she tells me regularly. So sometimes it's not as complicated as people want to make it. It's really just helping people move fluidly, use what joint function they have. Like one of these people, you know, your shoulder joint and your hip joint, they're supposed to be like this nice little golf ball shape. And as we age, they flatten down and they don't sit in this nice little tee and golf ball situation that we have everywhere else. And they start to flatten down. And then that causes pain. So we want to stretch the joint. We want to move it. We want to make sure that that process is also as comfortable as possible. Like 20 years ago, if you went in for frozen shoulder, it was incredibly painful. My mom came home crying from therapy and she hated it. Now I can get people moving way faster than that. And also, I love my practice because I'm the only one that sees my patients. Like, you see a doctor of physical therapy when you come to my company. That means I don't hand you off to a PTA or a tech that's running you through 30 exercises you could have done on your own. And I do not need to sit and babysit you riding a bike. If you did that, you're going to tell me, hey, I got this done before you came here. Perfect. You did your homework. Here's the other 3 things I need to work on with you today. And then this is your new homework. So if it's something specific like that, I just call that bang for your buck. You want the bang for your buck? They're honest with me too. So I like all of that. And it really is, with aging, it's about keeping your body limber, your mind sharp, and then keeping yourself appropriately challenged. I mean, like, I'm not putting them on balance beams or anything, but if we're not challenging balance and they can't get up off the floor, I haven't done my job.
Can you imagine being the physical therapist to the Olympics?
Oh, that would be amazing.
I'm sure they carry theirs. You know, I look at our young generation now, right? We live surrounded with an iPhone. You look at the posture, they're all hunched over, right? Down like this. So we're going to get a generation of poor, we already see it, poor posture, hunch, neck, shoulder, carpal tunnels like this. Don't you see it now?
Oh, I call it Simpsons characters. So like when you're walking around, you kind of like look around and you're like, oh, here's a Simpsons character. Essentially, they don't have the muscle mass where they should have it. And we're not talking about people who are just out of shape. They're not moving their body. And it's half because of technology. We have access to everything. Some people aren't even leaving their houses to go to work. So they're not getting out of their car. They're literally not walking into an office. They don't do stairs anymore. Like stairs, like how many people do stairs if there's an elevator present? Rare. Yeah. Rare. So, even grocery shopping, I can order my groceries to my house. And don't act like I don't. I do. We have such access to everything at the fingertip that we don't move our bodies to go get it at all. Like anything. I mean, thank goodness my fridge is 40 feet away from my couch.
But it is killing us.
Yes.
You know, when I go into the mall, and it's, I'll go to the Mall of America or something, and I'll look at the rise in overweight and obesity, and they're young. They're kids. They're young.
Well, we know the obesity epidemic.
And I know, I don't believe in body shaming, but I also believe in good health. When I see somebody who's obese, definitely obese, who's young, I think of cancer, heart disease, sleep apnea, you've already doomed yourself. You've already doomed. And even the fact, we have because COVID and just lifestyles, people like to work remote. Somebody had said, and correct me if I'm wrong, that sitting in your chair, sitting is the new smoking. That if you sit in your chair at least 8 minutes, your metabolic rate drops 40%.
I don't know the numbers on that, but what I do know is we can increase our metabolism by doing a workout, cardiovascular increase at the very beginning of the day. And you'll help yourself if you're just getting up and increasing your heart rate. I'm not talking like get it up to 150, but everybody should know where their target heart rate is. In general, for young, healthy people, we're talking about targeting a heart rate of about 110 to say, hi, I'm exercising. And you want to do that regularly throughout your day. So if you want to run up a flight of stairs to jack your heart rate up, that carries you through the next hour or two. And so it's important to regularly be physically active. There's a reason that they have those little pamphlets on the plane that say like, pump your feet and move your knees and walk around.
You have blood clots.
Blood clots.
You have blood clots in your legs.
The perfect example of how just a change in an environment can cause you massive risk factor increases from sedentary sitting. Like it kind of blows our minds, right? So as far as sedentary lifestyle goes, that's why it's not just the obesity, it's diabesity epidemic, and it is unfortunate that we're essentially teaching younger generations that inactivity is the way. We put them in sports and like that's fantastic. But how do we become active adults? How do we encourage even people who have had, I hear people, well, this is my bad knee. Okay, well, your bad knee still needs to move like your good knee because I need you to be able to get on this plane. I need you to be able to go on vacation and see your family. So the goal of being able to do something with as normal integrity for your joints and your body and your personality, like we just got through the COVID pandemic. And if it didn't make it very clear to everyone that socialization was so incredibly important, if socialization is not written into the goals of my patients, I'm asking them, who is important to you and how can we see them? How often can we see them? Why isn't that on the calendar? Because now I've created a goal and a timeline and we're going to get there. No matter what, that's happening.
So when you go now, you're different. You have your own private practice. You don't take insurance.
No,
but you go to people's homes.
Yes.
What do you get out of that visit?
Oh my gosh.
Why is that so important to you?
Okay. So it is actually an awkward situation to walk into someone's home. And I'm going to say that like gracefully, because when you do that, you're making them the boss of the situation. Some people like that and some people do not. So you're sensitive to all the environments that they have. You are sensitive to their spouse and their spouse's needs. You are sensitive to any of the insecurities of the home. So like I saw someone who was a hoarder. And it was really difficult to make space in the home for us to do anything. And I actually realized that this person was not moving because she was like frozen by her environment. Is that weird?
Yeah, but she discovered she's a hoarder.
Yeah, clearly, but just by going to her home.
Yeah.
So obviously, not very many of the homes that I enter are like that, but I get to meet their wives. I get to know their dogs' names. I mean, I am part of their life. And it is one of the most unique aspects of what a provider can do. And also, I get to brag about this. I get to see my patients more than any other provider in their unique situation. And so I feel like I get to most accurately report what goes on. Because sometimes when we see people in the clinic setting or I see people in the hospital, they're like, I have 12 stairs, but like I have a room downstairs. Okay, but they didn't tell you that that room is full of like equipment and they're never going to sleep down there.
Yeah.
And so they've essentially slept on a recliner for 3 months.
Yeah.
But they told you they have a room downstairs. So there's all these factors that you really don't know about. And really the patient needs more information and the provider needs more information. So when I write a doctor's note to a physician saying, hey, these are flags that I want us to like look at, or we might need this for the house. I've seen it. I've seen it firsthand.
Right.
And also the unique relationship of coming into someone's home is they trust me. They trust me uniquely as a provider and as their friend. And so I have the ability not to factory orient my business, but to friend orient, to familiarize, to build relationship with these patients. And the number one responsibility I have out of that is to advocate for them. Even if I'm not making friends in medicine, it is my job to speak the words that they're too afraid to say themselves. So, you know, I wish that all providers could see from this angle. But bigger than that, I think we're called to serve patients to the best of our ability. And that's actually why I don't accept insurance. It's because the medicinal model that I was practicing under was honestly very restrictive. In the hospital, I had a limited amount of time to go and review even a patient case that I actually need to know all of their levels before I go in and stress them for a patient that just had a heart attack 3 days ago. And it is crucial to have the amount of time that you need to invest in taking good care of people.
Yeah. Somebody's going to ask, so are you a trainer? So what's the difference between what you do and people who are personal trainers?
I'm about to make 313,000 people upset. I think a lot of PTs are glorified personal trainers. If you go in and you get assigned a piece of paper with 30 exercises on it, you can do yourself at home. And then you come in for 16 visits to do the same thing. And all we did is increase your weight by 10 to 15 pounds. I don't understand how I'm providing you skilled care. If I'm teaching you how to progress yourself and what to do if you have this pain again. I mean, 40% of the population over 40 is going to have back pain, and 80% of that population is going to have recurrent back pain. If I don't teach you how to do it yourself, what am I doing here?
Right.
So I want to prevent you from coming back, even though, hey, guess what? I have a business. Like, I get it.
The goal is for you to graduate and move on. You don't
graduate. Yeah. And become independent about learning how to take care of your body in this physical realm. Keep yourself challenged, keep yourself moving, keep yourself healthy, well into like the longevity of whatever age you're going to live to, and like make the best of it. Like literally live it. be it, move it, see it, feel it, do it.
Well, that's your whole life. It's what you believe in, and it's what you do with that. I mean, it's amazing that you do that, but not everybody does what you do. That's for sure, right?
It's easy to get sucked into the cog of the machine.
Right.
And I've been there. I hated my job, honestly, when I first started because I could tell that I wasn't having the impact that I wanted. Okay, so everybody knows about the VA system. I worked for a piece of an associated facility for the VA as a traveler, and it is the one and only job I ever got fired from. I have no problem sharing that because the reason I got fired is because I was complaining about the kind of care that everybody knew was going on. I found a patient on the floor when I walked in. They'd ordered physical therapy to get him up. And I'm like, the minute this person was on the floor, the entire staff should have been on this. And creating things that create positive change is something I don't want to back down from, even if it costs me whatever it costs me. I just don't want to step back on who I am and who I've grown as an adult woman to be and say, yeah, it's okay. We shouldn't say anything because it helps people like get along in whatever way. For people who can't speak for themselves, for the people who can't think for themselves, for the people who can't move for themselves or advocate for themselves, for the people who don't have family members coming in to be the bug, I'm fine. I'm fine doing it. And it took me so long to get there. But again, you don't have to make friends to be amazing at what you do. And honestly, if that's your only goal, go be in something else. Go be an influencer on social media. Have fun with that.
You're one of those who's really the challenging one. You get it. And it takes courage. It takes courage. And I always think, when somebody tells you, and I always tell groups, never accept we've always done it this way, because that's not a good reason.
It's the death of progress.
It's a death. And by the way, the VA, I was on their committee to overhaul the VA, and that is the largest healthcare association, the largest healthcare system in our country. And we could do so much better. We're so much better.
I saw my family in those beds.
And you can still see it. I mean, but you're unique. And I wish as many people would be that way. And you have so many gifts that do that. So my goal is to have more of you and you to continue what you do. But for you, what nourishes you as a professional, obviously financial things that is business. But what also fascinates me about you is you're not just a doctor of physical therapy and a businesswoman. Tell us about the other things you do. In addition to all these things, you do other things.
So some of the other business end of things I do during COVID, obviously in my area, I kind of was still newish in my business, newly independent in my business. And I contracted for other companies so I could see how some companies were on the growth spectrum. And I was like, I'm kind of happy doing what I'm doing. But one of the communities I was in, I could see all these small businesses essentially reaching out 100 times a day to advertise their business. And we couldn't do that because, listen, nobody wants to watch commercials all day, right? It was like, I'll turn this off instead of engage in the community. So I said, why don't we fix this? Why don't we meet up, see how people can get to know each other so we can actually refer each other business in a healthy way, see who's good at what, see who needs resources for what. And then essentially it turned into this little business club. So we had 8 people in a coffee shop. Now it's 2,000 Arizona business owners doing business together. But that actually, I was realizing, did not serve my unique healthcare circle enough. And I needed resources. I needed a Pilates person. I needed a massage person. I needed a pulmonologist. I needed a cardiologist. I needed people to refer patients to, and not just a name. I needed the style of medicine that they treat in. I needed a personality type that I knew that I felt safe and comfortable referring someone to, because, there's oh, that doctor has a terrible bedside manner, but he's so intelligent. And you're like, some people are not going to deal with that. Some people that you would refer people to, they're going to be like, if they're not smiling at me and I'm not the big cheese, find me a new person. So you're matching personalities, style of medicine, intellect, and their field.
Right.
So I needed to throw a bigger net, find more of what I needed. So I started out of Scottsdale Living Business Edition, a women's edition, which again is just to positively impact women in the community. And then I love this one the most, which you're going to speak at on September 3rd. Thank you so much. Is Scottsdale Top Docs. And it's not really just Scottsdale healthcare providers, but it started as 8 PTs in a room where I was talking to them. Some of them have been in business for 20 years and do MSK ultrasound with the physicians, and they've got their practices like on par, niche, everything. And then people who are just starting out in their own cash pay practice. And there were a lot of questions to ask and go around the room and assess together. So it was a little bit of a think tank. I expanded that to include as many healthcare professionals as can possibly be included that are excellent at their job. And I think that that's a big differentiator. Yeah, you can be part of a club, but are you any good at what you do? Listen, your reputation precedes and follows you. I know you from notes. I know you like before I've ever met you. I knew you before I met you for like 5 years because I treated patients. You didn't know me, but I knew I wanted to do an excellent job, and you ended up knowing me through my work. You ended up knowing me through that. So it says a lot when we are kind of pulling people together in any format. And I do believe that, whether or not you think you are the best, sometimes you're offering something the very best that you are unaware of, and the community can help you hone in, come to be better at whatever that is. And feedback is crucial for that. So as I'm growing this community of healthcare providers and wellness professionals, like I said, sometimes I need a breathwork person.
Sure.
Some patients ask for all kinds of things.
They help your patient.
And who am I to say that that person is not going to get better because they asked for something that the regular medicine system isn't asking me about. So sometimes they're asking me for really unique resources. And so I need to be able to bridge a gap in healthcare that currently doesn't really exist. When you go to the hospital and you need to go to a skilled nursing facility, they slide you this paper. You have no information. And like I tell people, you got to go visit these places. And you also need to do some independent research on the reviews of these, do a tour, and you got to do it today because they're going to try to discharge this person in 12 to 24 to 36 hours.
That's what my patients tell me. We're going to send them home. Here's a list. This is what insurance will cover. And the family goes and starts visiting. And from what I know of, having had patients, I go, oh, I'd steer clear of this. Or I'd go here. I talk to this, and that you just navigate.
I mean, luckily I worked at a bunch of like acute rehab hospitals.
So you've seen them.
Yeah. I actually go and visit patients. I have a lawyer friend. Her dad was in the hospital. So I went and visited him there. Then he was transferred to a skilled nursing facility, and they would not let him discharge, which means leave the facility without 2 people at home. And they had hired a nurse. And I thought, well, why? So I went and visited them and asked the director of rehab, not going to say the place, well, how come he has this recommendation at home and here? I'm sure you have people that do a 1-person Hoyer transfer, and at home, there's no way that this person's going to have 2 people all the time, and they're paying a nurse that's qualified. So I said, if I am able to demonstrate that I can do it and then teach a family member to do it, or the nurse who was actually there.
You had 2 people.
Then can I, if I can demonstrate that we do it independently, then can you increase or upgrade the discharge plan? And it was interesting to hear her say that Medicare required 2 people for a Hoyer. And I said, how does anyone get home? Tell me how that makes sense.
Yeah.
Say you're 85, you have a spouse, they can make you meals. They can essentially use this little machine and get you into a wheelchair. But now I have to have a second person. You know, it can be $20,000 and up a month for just a nurse.
Yeah.
And some of them won't do mobility.
Yeah. I mean, the goal is
how do we
get
afford
home.
this?
The goal is get them home functional. But see, what you have that you demonstrate is you don't just accept as if. You push because you advocate. Because, you know, not only do you treat, you advocate, and you're definitely hands-on. Isn't like just checking the boxes, just do the repetition, you know, because you are all in.
Yeah.
You know, and you are more than hands-on. You're it's really not hands. It's not only your hands, it's your mind and your heart are fully engaged in your
These
patients.
people become my family. I see them more than anyone.
Well, you're a healer. You know, you want to make a difference in their lives. It isn't just a repetition. Okay, we're going to get you better, and then you're going to go and it expands to other parts of your life. I mean, you just thought, you know, I want to form a group of other like-minded physicians because, you know, those are your competitors, but you don't see that. I mean, no, really. Yeah. You know, but you get to know them. So you're not the competitor. You can be colleagues, you can share, and then you become a better healer and provider as a result. I mean, you have your own podcast because I've been on your podcast.
Yes. Thank you for being on it. I loved that episode.
The most important thing of our skill is communication.
Yeah.
If you can't communicate, you know, look what you do all day long. You communicate your patients. You communicate constantly.
Yeah.
Right. So it's really all that, but can't believe, see, I told you it's like the fastest hour.
It
And
is.
we'll have to have you come back and do another topic.
Okay.
Because you're such a delight. And I still got to work you on a television gig. I want to be
I'm
going to be your agent. I'm going to be your agent. So any last moment words of advice to people listening? I don't know if they're sitting, they might be walking, listening to this, or driving, but any last moments words of wisdom to anybody out there?
I think that one of the biggest things would be if you're not finding joy in an improvement with what you're doing with your life and you have something going on that a physical therapist can help you with, you can shop around. You can shop around for your doctor. You can shop around for your physical therapist. I love what I do. And if you have something that they're not really familiar with and you just say, oh, they're nice, you can still shop. It's okay. And you're not offending anybody by speaking up for yourself and getting the best possible care.
And then if you're smart enough to want Dr. Amber Enright, go to the website and for her contact information.
Yeah. So my company is The Therapy Doctor. My website is aztherapydoc.com. And Amber Enright, we're moving you with heart.
Oh, I love it. Well, thanks for being on my show. You've been a delight.
Thank you so much.
Thanks
for having
again.
me.
Well, thanks for listening to our August house calls. I want you to all stay cool-minded and take care of yourself and just have a wonderful rest of the month. And we'll talk with you next month. So take care and God bless you all.
Thank you again for joining us this week for House Calls with Dr. Connie Mariano. We'll be back next Thursday at 7 p.m. Eastern Time, 4 p.m. Pacific Time on the Voice America Empowerment Channel. Have a terrific week.